A 40-year-old woman presents to her family physician with a 3-week history of swollen neck. The small, round and painless swelling which was detected 3 weeks ago in the middle of her neck has now increased in size. The swelling is associated with sweaty palms and soles, insomnia, irritability, nervousness and fatigue. However, the patient does not complain of fever, cervical lymphadenopathy, weight loss, vision problems or body swelling. Sorry. The patient's medical history is negative for similar symptoms or a thyroid disorder. The vital signs are within normal limits. Local examination reveals a 3 to 3 centimeter round, non-tender, non-fluctuant, and non-pulsatile swelling in the anterior triangle of her neck. The patient carries a total WBC count of 10,200 per millimeter cube, including 70% neutrophils, 30% lymphocytes, and 0 eosinophils. The ESR is 20 millimeter per hour. What is the most likely diagnosis? So for questions like this, it's important to know sort of like the physiology of the hormone. Like you kind of need to know what it's acting on, its effect on all the three metabolism, like your protein, fat, as well as carbohydrate metabolism. Because once you know that, it becomes easier for you to remember. Like I mentioned, like carbohydrate, you know it's one of the anti-insulin hormones, so you know it's going to promote gluconeogenesis, resulting in hyperglycemia. So fat, once again, since anti-insulin, okay, it's going to promote in your, fat deposition in the center, as is normally seen in the case of insulin resistance. So you kind of go with that. It becomes easier for you to remember rather than sitting and figuring out. You're rather just learning the points. If you go metabolism wise, at least this is what I followed, it does help a lot. It makes it a lot easier. Okay, so coming to the last question. Okay, so yeah, most of you got this right. The only main important thing in this is she's having features of sweaty palms and soles, insomnia, irritability, nervousness, and fatigue. So she's having signs of hyperthyroidism. Okay, in addition to that, she has a non-tender, non-fluctuant, non-pulsatile swelling in the anterior triangle of her neck. Her ESR is normal. So ESR being normal, rule out option B, that's your subacute granulomatous thyroiditis. D. Quervin is just another name for it. Okay. And nothing really points towards a diagnosis of Graves' disease. Okay, she's not having the typical thyroid ophthalmopathy or pretypical mixed edema. Okay, just kind of hyperthyroidism in general. Rule out Graves' disease. Okay. Oh, sorry. Before that, option C, silent thyroiditis is the right one. This is usually seen in the postpartum period, though nothing has been really mentioned about this patient, being in the postpartum period. They do not mention anything about recent delivery. Just know that it usually happens in the 30 to 50 year age group, like in the reproductive age group. Okay. And in addition to that, usually silent thyroiditis will present with, like I mentioned, phases. So it will first have hyperthyroidism, then it will go for a phase of euthyroidism or hypothyroidism, and then finally it's gonna go for your, hypothyroidism. Okay, and that's how it usually presents. So in this case, since she's presenting with signs of hyper, probably means that she's kind of in the initial phase of it. Okay, before she goes for euthyroidism. Hashimoto's thyroiditis. Okay, yes, Hashimoto's can also present with an initial phase of hyperthyroidism because of rapid destruction of your follicles. Kind of very similar to what I explained for the radioactive iodine. You're gonna kind of ablate all your thyroid follicles. In this case, your autoantibodies are attacking that. You're gonna have a release of your hormones, presenting with an initial spike in your T3, T4 levels. Okay, but even apart from that, there's no other, like they've not mentioned any of the other autoantibodies in this case. Okay, and her WBC count is fine. Okay, so you can just kind of rule it out. Riedl's thyroiditis, if they ever want you to know that Riedl's is the correct answer, they would 100% mention about the I think it's like rocky heart swelling that's seen in thyroid because of the intense fibrosis. So I don't know if it's rocky heart or stony heart, one of those two. Okay, but extremely hard. Okay, nodule that or mass you're gonna see in the thyroid. So anytime they mention that, you don't even have to think twice. Just go for Riedl's. Nothing has been mentioned about it being hard. They just mentioned non-tender, non-fluctuant, non-pulsatile. So it's kind of like diagnosis of exclusion almost. You kind of rule out everything else. You're left with silent thyroiditis. Go with that. Okay, if you're not sure of the thing, it's easier to rule out answers for questions like this rather than select one and then be a little unsure of yourself. Questions like this, it's better to rule out because you're more confident about the other options than you are with silent. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.